Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating case report that highlights a successful approach to managing a prescription error with potentially life-threatening consequences in a feline patient. This isn't just a story about a mistake. It's a testament to the power of careful observation, timely intervention, and the judicious use of medication in veterinary medicine. Our story begins with a 16-year-old spayed domestic short-hair cat, already navigating the challenges of hyperthyroidism, constipation, a heart murmur, persistent tachycardia, and stage 2 chronic kidney disease. This cat's hyperthyroidism had been diagnosed several years prior and was being managed with methimazole, an antithyroid medication commonly used to limit the excessive production of thyroid hormone. The standard dosing regimen for methimazole usually includes an initial dose of 2.5 milligrams every 12 hours. Then, a prescription error occurred. The cat's owner requested a refill of methimazole, but the prescription was incorrectly filled with azathioprine tablets. Compounding the error, the prescription label still indicated the methimazole dosing regimen. The owner's daughter, who was unfamiliar with the appearance of the previous methimazole tablets, administered the incorrectly filled prescription. For 3 days, the cat received azathioprine twice a day before the error was discovered. Azathioprine is an immunosuppressive agent primarily used in dogs for immune-mediated diseases. It inhibits the synthesis of purines, adenine, and guanine by blocking certain enzymes, resulting in the production of non-functional nucleic acid strands. This ultimately disrupts DNA and RNA replication, inhibiting the proliferation of fast-growing cells. In simpler terms, azathioprine is a powerful drug that suppresses the immune system by interfering with cell growth and replication. This medication is not recommended for use in cats because of the high risk of bone marrow suppression. Upon discovering the error, the owner immediately contacted the veterinary hospital. The cat was examined, and blood work was performed. The initial examination, just 4 days after the azathioprine was first given, revealed that the cat was normothermic with a normal heart rate. However, the complete blood count told a different story, showing leukopenia and neutropenia. The cat's white blood cell count was low, and the number of neutrophils was also below the normal range. To better understand the potential consequences, the veterinarians consulted with a toxicologist at Poison Control. The toxicologist's report indicated that the cat had received a very high dose of azathioprine, far exceeding the recommended feline dose. The toxicologist warned of potential gastrointestinal issues like vomiting, diarrhea, and anorexia, as well as myelosuppression, which could occur within 2 to 3 weeks. There is also a risk of hepato and nephrotoxicity. Regular monitoring of the cat's blood was recommended. Despite being discharged for monitoring, the cat's condition soon began to deteriorate. Within a few days, the cat was hyperexic and vomiting. A repeat blood test showed that the neutropenia persisted. Mirtazapine, an appetite stimulant, and meropetant, an antiemetic, were administered. Unfortunately, the cat's condition continued to worsen. The cat was now hyperthermic and tachycardic and had lost weight. The neutropenia had become much more severe, and mild anemia was noted. The cat was admitted to the hospital for intensive supportive care. Treatment included intravenous fluids, mirtazapine, meropetant, pantoprazole to protect the gastrointestinal tract, ampicillin and enrofloxacin for antibiotic coverage, and a continuation of methimazole for the hyperthyroidism. Given the severity of the neutropenia and the lack of response to initial treatment, the veterinary team decided to incorporate Filgrastim into the treatment plan. Filgrastim is a cytokine hematopoietic agent used to increase the proliferation, differentiation, and activation of progenitor cells in the neutrophil granulocyte line. In essence, Filgrastim stimulates the bone marrow to produce more neutrophils. The cat received its first Filgrastim injection. The dosage and regimen used in this case was 5 micrograms per kilogram, subcutaneously, daily for 4 injections. The cat was admitted to the hospital daily for monitoring after each injection. The following days marked a turning point in the cat's recovery. While initial blood work showed no improvement, the cat's appetite returned and its weight stabilized. By the 3rd Filgrastim injection, there was an increase in neutrophils. After the 4th and final injection, both the neutropenia and anemia began to improve. Over the following weeks, the cat's neutrophil counts and red blood cell levels continued to normalize. By day 41, the cat presented with difficulty walking, and a blood test revealed neutrophilia, meaning an elevated neutrophil count. This was likely related to mild spinal arthritis, which was diagnosed via radiographs. The cat was given pain medication, and antibiotics were discontinued. By day 49, the cat's neutrophil counts were within the normal reference range. In this case, Filgrastim was perceived to have a successful time response in normalizing the neutrophil cell count after severe neutropenia secondary to Azathioprine toxicity. The cat experienced mild signs of pain days after the course of injections, which has been reported as a side effect after Filgrastim injections in humans. The owner reported an increase in stiff gait and an increase in vocalization when being picked up or when limbs were touched on day 41. Bone pain is the most common adverse event with Filgrastim. So, what are the key takeaways from this case? Prescription errors can have devastating consequences. This case underscores the importance of verifying medications and dosages, especially when dealing with drugs that have a narrow margin of safety. Filgrastim can be a valuable tool in managing Azathioprine-induced myelosuppression in cats. While azathioprine is not recommended for use in cats, accidental overdoses can occur. In such cases, Filgrastim may help stimulate neutrophil production and improve the patient's outcome. Cats are more susceptible to Azathioprine toxicity than other species. This is due to their lower levels of thiopurine methyltransferase, an enzyme responsible for breaking down azathioprine. Without sufficient TPMT activity, azathioprine can accumulate in the body and cause severe bone marrow suppression. This case report serves as a reminder of the potential dangers of prescription errors and highlights the importance of careful medication management. It also demonstrates the potential benefits of Filgrastim in treating Azathioprine-induced neutropenia in cats. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.